everybody. This is Justin Johnston, Executive Director of the Community of Hope Health Clinic in Pelham, Alabama. I was just wanting to get on here and introduce myself, introduce the fact that we are starting a new podcast here for the Community of Hope. The goal of this is to get the word out about all the work we do, let people know that we are here in Shelby County and that there are resources out here that are doing good. And really looking forward to setting this up and going from here. This is something that I'm new to, something that I hope that I can learn a lot more as I continue to go on, and hopefully in the future we'll be able to be a little more graphic heavy, and I'll be able to show a few more videos or pictures or whatever. But right now I'm just doing pure video and sound. So um, today we're all about talking about what Community of Hope is. Um, But before I get going, I do want to bring attention to, if you're watching the video stream of this, the sign that's up above me on the TV on the monitor. That's got all of our point and leaks on it. If you're just listening to this as an audio file, I just want to let you know that you can reach us. You can learn more about us by going to www.communityofhopeclinic.com. You can reach us on Facebook. If you go to facebook.com/Community of Hope Health Clinic, that's all one word. Or you can go to Instagram.com/CHHC_ShelbyCo. Or if you have the app on Instagram, you can always look us up at CHHC_ShelbyCo. So those are very important to us, and there's a good way to not only keep in touch with us, but also see what's going on in the clinic aside from these podcasts and videos that we do. So, Community of Hope Health Clinic, what are we? So, we're a free and charitable clinic located here in Pelham. We service all of Shelby County, and we have a staff of volunteers, providers, nurses, interpreters, etc., who see people who are adults of Shelby County, who live in Shelby County, who are at or below 200% of the federal poverty guidelines, and don't have access to private insurance or a government programs such as Medicare, Medicaid, or VA benefits. So I wanted to kind of start off with that and then kind of give you a little brief history of what we're doing. When I say brief, it may take me about 5 minutes to run through it, but it's something that I think everybody, when they learn about what's going on, they're usually some people are very surprised at what we've done. So, Community of Hope Health Clinic's been around for almost 16 years now. It'll be 16 years this coming March. So on March 28th, 2008, CHHC got its 501c3 tax ID, meaning we're a nonprofit. And this came about after a group of business people, clergy, government agencies got together and said, hey, we got a sick population in Shelby County that are not getting the services they need health-wise. And so after doing some digging and figuring out how to create one of these clinics, it came to fruition. And pretty much ever since, we've been seeing people on the regular. So I would really say that 2010 was probably the best time frame to say that we began seeing patients. And since then, we've been seeing patients on a regular basis for about 48 to 50 weeks throughout the year for every year. When we started out, we were just an urgent care facility model. So what that means is that patients would show up on a Thursday evening at the health department here in Shelby, and they would line up. They make sure they had all their paperwork they needed, and then we had usually about 2 providers that were here that would see them until the last person was seen. So we're talking 20 to 25 people would show up every Thursday to be seen, and that was good for a while. But then the demand just picked up, and I guess about 2010 when we really started changing our model. And I know that 2012 was a big year as well. So what ended up happening is we went from an urgent care facility to more like an appointment-based clinic that you would see throughout, all all of Shelby County, the state of Alabama, and really the United States. And we became appointment based. Through a grant, we were able to rent some of the space at the health department, and we opened up on Monday mornings. And so we were seeing patients on Monday mornings and also Thursday evenings. And it was a couple years later we expanded to Tuesday mornings. So next thing you know is Monday morning, Tuesday morning, Thursday evenings. And it was that point that I came on board with the Community of Hope Health Clinic, which was May of 2015, and we began to see different ways that we could grow financially, but also grow within the scope of services. So I would say from about 2015 to 2020, we were pretty steady with our work. Mondays, we had actually added once a month a Monday evening clinic, and excuse me, and then we were also doing our Monday mornings, Tuesday mornings, Thursday evenings. And 2020 came around, and we started seeing some inklings of some different uh, different types of services that were wanting to come around. I'd already had some discussions with some physical therapists and some occupational therapists and things like that, but um, we really started to see kind of an interest in different ways that different providers could give back to the community through us. And then, just like everybody else in March of 2020, we had to stop everything completely. We shut down. We were the clinic itself was shut down for about 2 weeks before the staff came back to kind of work things out, and we started using some of the uh, HHS. We started using some of the telemedicine uh, programs that we said that we were told that we could use or previously couldn't, like Zoom and Skype and whatnot. And um, it took us a couple months, but by June 1st of 2020, we were actually up and running. We had a protocol going. We had a way for us to do a screening to see if people were actually uh, had COVID symptoms and had been exposed. And we began working with different groups like the Area Health Education Center here, in not only in Birmingham for the statewide program, but also with some of the other centers. And um, that's kind of where we were. And this was June and July. Well, it was around this time also that I began to think, well, we were coming up on um, the time in which we needed to look about the possibility of moving, because at that point demand was high. We had a lot of providers. And so, right in the middle of the pandemic, we packed everything up and moved to our second location, which was next to Pee Wee's Pawn Shop in Pelham. And thing about it is it was a space that was much bigger. We went from 1,900 square feet to about 3,600 square feet, and we had exam rooms, and we didn't have to worry about we were going to have enough providers or exam rooms for our providers, and it was great and all. And then about 6 months later, we realized, hey, we've about outgrown our space here at 2692 Pelham Parkway. But you know what? We just like any other free clinic would do, we were able to make do with what we had. And I knew that at the end of 3 years, we would be able to possibly move again, maybe to a space that was more conducive to what we were doing. Um, in this time, the reason we moved out, we were in the possibility of moving again, and we had already outgrown our space. It had everything to do with the way our services had grown. So we had started off as a primary care facility. 2020, we saw the addition of physical therapy, and that program grew from one physical therapist to somewhere between 5 to 6 physical therapists at one point. Um, we had we had a dermatologist that came on board, so we're doing a dermatology clinic. I was approached in 2018 by the Hispanic Interest Coalition of Alabama about a program for undocumented Hispanic women who were receiving no prenatal clinic. And during this time, we implemented that. We got help from the Rotary Club and bought an ultrasound and got a nurse practitioner and then an OB to come in and do that kind of stuff. Um, our physical therapy program was robust and that was growing. And then next thing you know, a lot of people, of course, had issues with mental health because of the pandemic. People were losing their jobs or they were losing money. They weren't able to support their families, and they were having to come to us. And we had issues. People needed counseling. They needed somebody to monitor their medications and monitor them from a medical standpoint. And so, we got a grant to handle that. And then, of course, when you're dealing with a medical practice, medication is also a big barrier, especially with our population. And so we began looking at, how can we uh, expand our services to include giving out chronic medication for patients with their chronic conditions, their blood pressure medications, their diabetes medications, stuff for high cholesterol, gout, you name it, but also with our mental health, some of the non-controlled substances that were mental health drugs. And so, we're sitting here, we're like, okay, we want to do all this stuff. There's money out here to do this, but we're just bursting at the seams. And so I find it funny that our dumpster out by our old facility happened to be butt up next to another building that when I looked at it, I was like, man, this looks like a pretty nice building. It was one level, and I looked at the listing and I said, man, if we could get this would be great. And next thing you know, it's July 2023, and we're moving for the second time. But this place has been much better for us as far as what is conducive to what we want to do. And so that's what we're doing. So, right now we have a physical therapy room, we have a mental health room, we have 4 exam rooms, where one of them we do specialty clinics in. We're talking about opening a laboratory so we can do blood draws and do point of care testing here at the clinic. And that way we don't have to outsource so much. We've got 2 rooms dedicated just to triage. We've got a huge waiting area. We've got a room dedicated just to our medication dispensary where we're giving out $40,000 worth of drugs in the first 6 months. Um, all of them are non-controlled, by the way. So if you're thinking about we're making all this money, we're not. It's just all of our services are free. And and my staff, we all have our own offices. So when we bring a patient in, we don't have other people that can hear what we're talking about. We got that confidentiality there. We're able to house a member of the Hispanic Interest Coalition of Alabama here so they can see patients who are in Shelby County because they had lost their presence in Shelby County with a physical space. I mean, just to see what we've been able to do. This room I'm in right now, this is our conference room, and we have a meeting space, and we have community members that can come in here and meet. We're about to expand again to add um, optometry services. We have so many diabetics, we have so many people with high blood pressure that have a symptom and something is caused by those illnesses is blindness. And so now we have a way for our patients to see if they're being affected by these types of illnesses. So you know, just what we've done in the past 4 years, let alone 15 years, is just remarkable to me. One of the things that I like to talk about is I like to talk about how our cash operating budget when I started was very low, um, but we've grown by 70%. Or I'm sorry, our budget now is 70% higher than what it was when I started. So our original budget would accumulate for about 30% of what it is today. We've actually increased it by almost 300% since we've been here. So it's just amazing to see the growth and see what we've been able to do. And I haven't even mentioned the fact that in 2021 we were approached by the county about uh, getting a mobile clinic so we could take our services out to those people in the county in the more rural areas who have issues with transportation. And just in 2023 alone, we went out over 40 times and saw hundreds of people, whether it was giving them vaccinations for COVID, vaccinations for flu. I mean, there's just just health screens, doing BMI checks, just out there showing people that there's ways for and there's services out there for them to get if they just know where to look for it. And a lot of times people don't have this ability to do that. So that's kind of what we've done. We've also partnered with other groups, like I've already mentioned, HICA. We've also partnered with AHEC, and the AHEC, between us and AHEC, we gave more than 13,000 doses of COVID vaccine throughout the course of about a year and a half or so. We partner with a lot of the Shelby County groups here, the Shelby County Shelby Emergency Assistance. We've done stuff with Family Connection. We've done stuff with the Shelby Baptist Association. And so, we're always looking to partner with different groups, and we're hoping that as we continue on, that this will be a fruitful endeavor for us to continue to help those people who have a hard time helping themselves. And so, really, the purpose of this podcast was just to let you all know what's going on, just kind of give you a little, this particular episode, just give you a little update on what we're doing, and hopefully I can bring on guests, and hopefully I can talk a little bit about what we do here at Community of Hope, so that in the future, um, you'll know that there's organizations out there, there's agencies out there that you can give to, that you can volunteer with, that your church can be a partner with. Um, we're always looking for those partnerships. So I guess that's all I really have to say about this today. I appreciate you taking the time to listen to my 20-minute rant about Community of Hope. It's a great organization. I've enjoyed working here. We have a great staff of 6 people, plus a few contract workers. We have a great board of directors. All this information you can find once again by going to our important links, which probably our most important link is www.communityofhopeclinic.com. You can reach us on Facebook at facebook.com/Community of Hope Health Clinic, or on Instagram at instagram.com/CHHC_ShelbyCo, or you can just look us up at CHHC_ShelbyCo for if you have the app. So I guess that's it. I'm hoping to do this on the regular, and we may do some stuff just for our patients in Spanish and English, just so they know some of the resources are available to them. But I hope that you would consider in the future supporting us. And if you would like to be a part of this podcast or this show, you can always reach me. Once again, my name is Justin Johnston. I'm the executive director. My email is justin@communityofhopeclinic.com. Um, and we'll go from there. So until next time, thank you very much. I hope you like this, and I hope you will watch further. God bless you, and